and then, but at any point, shout out if you want to ask anything or clarify anything. Or sharing's not turned on.
I'm just giving you host position now. Okay.
Or co-host. Great. Oh, thank you. Slide. I get this black bar in the way. Oh, it's down there, isn't it? Hey. Okay, so DEEP, we were funded for 10 years through the Health and Care Research Wales. So it's a research funded project, but it's now funded by Social Care Wales, who are the sort of workforce regulator for social care in Wales, and also the Service Improvement Agency. So they fund us, and we're basically based in Swansea and Bangor University. We're very small. There's me in Swansea, and it sounds like a big team, but it's me in Swansea and Jill Toms in Bangor University. And basically, in a nutshell, what the Developing Evidence Enriched Practice Programme is, or DEEP, it's a co-production approach to gathering, exploring, and using diverse types of evidence. So that includes, sort of research data and lived experience and all the stuff we were talking about in learning and development, with a focus on using story and dialogue methods. So that's what we are. We have a little motto from the old Welsh text, Mabinogion, Hafo Ben Byd Bont. You who'd be a leader should be a bridge. And we like to build bridges between research, policy, practice, and people, really, through dialogic and storytelling ways, really. So that's what we're about. I think I shared this quote before, but Welcome to the Machine is a sort of, I know it's a Pink Floyd album, but it's also a metaphor for social care, really, because I've worked in social care for years, and it's increasingly become like a machine and mechanized. It's all driven by process. Well, at least it is in the UK. And this is a quote by John Seddon, who's part of an organisation called Vanguard. And he's very critical of the way local governments work. And this is his quote on adult services. Like the police service, adult social care is designed as a bureaucracy to feed the regime, not a service to meet old people's needs. The regime constrains method. It's a bureaucracy of call centres, functional specialisation, activity targets, budget management, form filling and counting, designed according to the requirements of the regime. And the bureaucracy is cemented with information technology, all of which has been designed from the point of view of electronic data management and reporting, not solving people's problems. It's quite damning, isn't it? I think this was actually Staffordshire Adult Services. So it was an English local authority that they got Vanguard in, and this is in one of his publications. But when you share that with people who work in public services, they say, oh, I can see what he's saying. It doesn't matter whether you work in education or health or social care. It has become very bureaucratized. And there's an American writer, Joseph Campbell, who says, if you want to change the world, you have to change the metaphor. So DEEP is very much changing the metaphor of social care from one of a machine to one of a garden, which is organic and beautiful and fickle and sort of changing and beautiful and full of all sorts of things, really, and interdependent, and it's got an ecology. And we think that's a much more healthy way of looking at social care and education and health. And to get a garden, you see what DEEP says, if you want to get a garden growing, the first thing you've got to do is you've got to create the right soil. You've got to put your attention on the soil. So we do quite a lot of work around how do you get the ground ready for people to engage with evidence, really. And there's a guy called Mike Nolan, who's a professor in Sheffield University, who's done a lot of work around culture change in health services and care homes. And he talks about creating an enriched environment of care, really, and where people feel cherished and valued, and they've got some kind of agency of what they're doing. And so you've got to get that soil right first. And then once you've got the soil right, then we say, well, you've got to gather the seeds of knowledge, and that's all the different sorts of data, really, isn't it? It's research evidence, it's lived experience, it's practitioner knowledge, it's organizational knowledge, policy knowledge. All of these types of knowledge are seeds to sow in the garden. And how do you sow the seeds in a way that they germinate? Because sometimes you can have the most really factual information, but if it's boring, people won't engage with it. So we're very interested in how you present evidence, whether it's numerical data or narrative data, really. It's the way you present things that'll get a hold or let seeds take root. And then lastly, once the seeds have taken root, how do you tend and grow the garden? And that's where we believe a lot in using dialogic methods of talking and thinking together, because we often find people don't talk and think well together. And bad talking and thinking leads to poor learning and poor outcomes, really. Just rubs people up the wrong way. So that's our metaphor of a garden for DEEP. And it started with a research project where we did start with some research messages about what mattered most to older people with high support needs. And then Joseph Rowntree Foundation gave us some money to say, well, there's some challenges we've found in what the way older people are supported. Do you want to explore these with the sector to see if they can put them into practice? So it was about putting these 7 research challenges of a better life into practice, and we did it in a co-production way. And this is like one of the places in Carmarthenshire that we did so really. So, and it was bringing old people, carers, researchers, practitioners, and managers, and we sat around and talked and ate cake and drank Pentimans lemonade. So a key thing about DEEP, because when people think about evidence-based practice, I've never liked the word evidence-based practice because it starts with the evidence and it sort of doesn't start with the people and that's not a good place to be. And there's an educator, he's died now, but he's an American educator called Miles Horton. And this lovely quote by him, he says, now the use of expert knowledge is different from having the expert telling people what to do. And I think that's where I draw the line. I have no problem with using information that experts have, as long as they don't say this is what you should do. And that's fatal in research. We often do that. We do some research and then we go and tell people, I've got the answers. This is what you need to do. And it sets up the wrong kind of relationship. So DEEP doesn't do that. We sort of present knowledge to people, but we encourage them to engage with it in their terms and in their world. It's a constructivist view of learning, really. And this is a nice quote from one of my heroes. He's Ian McGilchrist. He lives on the Isle of Skye and is a neuroscientist and philosopher, and basically very critical of the way we run the world, really. And he thinks that all of the problems are down to left hemisphere thinking rather than right hemisphere thinking. But this is a quote from him from one of his talks. My experience of education into everything was not about the insertion of facts. It was about a spark, a relationship between a teacher and me. It was the fire that animated from that teacher that raised the spark in me that was living and quite different from the dead data that was fed into me. This is what an education is. Being a teacher is about a relationship. It's not about stuffing things into people. Being a doctor is about a relationship. It's not about mending bits of a machine. We've lost sight of these very important roles. So it's this relational nature of learning and development. I think it's really important. So DEEP is really relational in the way we work. It's not sort of processy. It's relational. And the other thing is, DEEP isn't about using evidence, which sounds stupid because it's called developing evidence-enriched practice. But that's not our primary driver, really, is not to use evidence. And the reason I say that is because this is Paulo Freire, who's a great sort of educationalist, and he was asked, well, what's the primary aim of education? And he said, the key purpose of education is to create a world in which it'll be easier to love, which is great, isn't it? So, and if I get a group of practitioners around and say, I've come here to get you to use research, they switch off. But if you say, we're here to make the world a better place, then they say, well, that's why I came into the job. That's why I get out of bed in the morning. So the motivation has to be making the world a better place, not using evidence. If they can use evidence to do that, that's all well and good. But the motivation is to create a world in which it'll be easier to love, really, which I love that quote by him. And another guy I like this is Greg Boyle, who works with marginalized, demonized gang members in Los Angeles. It's the biggest sort of re-entry program and rehab program in the world, I think. And he's in the California, he got the California Peace Prize, and he's just been given some kind of award by the president of the US. So he's a fantastic guy. He's a Jesuit priest, and he runs Homeboy Industries, which does this amazing transformative work. And this is his motto for his organization. If love is the answer, community is the context, and tenderness, the methodology. And that's lovely because that's transformative. And I think those 3 things, love, community, and tenderness, apply to good learning because it's about making the world a better place. The best way to learn is collectively, not individually, because a lot of our staff get sent on boring e-learning training, tick box training, and they do it on their own, sat in front of a computer. But best learning is done collectively. And then it's tender. It doesn't make people feel inadequate, because we've got lots of stories of where staff feel they're sent on training because people think they're thick and they're useless, and it undermines their well-being, or they're pushed into their panic zone because they're made to explore things that don't make sense to them. So it's this idea of love, community, and tenderness. And there's this is from the NHS staff survey of well-being in the NHS in the UK. And if you look at the section on burnout, these are really startling figures from 2021, and they haven't changed. If anything, they're probably worse. 46.5% of the workforce feel worn out at the end of their day, and 39.4% say their work frustrates them. 38% say they find their work emotionally exhausting. So if we're going to get people to engage with evidence now, then we've got to do it in a tender way, because it can't be another thing that we put on the workforce, because they'll just collapse really. So basically, DEEP has this set of principles, and then we have a range of methods. So the principles, they're quite straightforward. And again, we haven't invented them. We've just discovered them and found them in other places, really. The first is this idea of interdependent well-being. So if you want good health and social care services, you've got to look after unpaid carers and families, and you've got to look after practitioners. And basically, if one of those groups is unhappy, the thing falls apart, really. So it's about everybody's well-being. And secondly, that if you want to facilitate learning, you've got to do it in a human-centered way. And we draw a lot from the world of social pedagogy on that. That you've got to be really sensitive to the way people construct knowledge. So you don't just give knowledge to people; they make sense of it in their world, and you've got to engage. You've got to start in their world and bring the knowledge into their world, rather than think you're going to put knowledge into them, really, if that makes sense. The other one is really important, and we were taught this earlier, weren't we, is about valuing and promoting what they call knowledge democracy. So this is what counts as knowledge and whose knowledge counts. And of course, some researchers might say, oh, randomized control knowledge, and that's the knowledge that counts. But lived experience, well, that's a bit fuzzy, isn't it? We don't count that as much because it's a bit subjective. And that's not true, really. So there's quite a bit of research, and Peter Beresford does a lot of work on this, on how we have to value different types of knowledge and how they complement, and they might challenge one another, but they work together. So we like all sorts of knowledge in the mix. That if you want to get people engaged, that we use stories and provocations. We don't just present dry facts. And you see that with charities, don't you? When charities want to get your interest, they used to put all the data in front of you, but now they tell you sort of Rahid's story or something, and then you're straight in with the story. So stories are really important. Talking and thinking together is really important. And this is vital, we think, because so much misunderstanding and miscommunication and ill feeling and that can be caused through bad ways of talking together. And that leadership needs to be shared. So we see leadership not as a role, but an activity for everyone. So leadership is something people do when they've got some kind of agency and they show initiative. And then the last one is that if you do whatever evidence you use, you must always be sensitive to context. I know Jim was saying it's all about context, and it is, because what works in one situation won't work in another. So that's the danger with things like sometimes the NICE guidelines. They say this is what you must do. Well, it all depends on the context. You might have to adapt your evidence according to context. So those are our principles. And then the methods, we explore how do you gather and present evidence in interesting ways, really, and then how to explore and use evidence. And that's what I wanted to cover in the rest of this afternoon, if that's okay. You look at some of those methods. So just a few last slides about the DEEP approach, and then we'll stop and have a chat. And the first is this idea of interdependent well-being, and a framework we use, and we found it really helpful because it's really simple. It's simple but not simplistic. It's the Senses framework that Mike Nolan produced. I don't know if you know about it, and he says it doesn't matter in who you are in a service. So in a care home, it doesn't matter if you're a resident, a family visitor, or a care worker. You all need these 6 senses, and everything should work towards. If you get these 6 senses right, you've got what he calls an enriched environment of care and learning. So a sense of security, so you feel safe physically and existentially. That you have a sense of continuity. So what you're doing in the present has some link with what you're doing in the past and where you want to go. So there's some continuity in your work. And often in a world that's constantly changing, this sense of continuity is broken, and that really stresses people out. A sense of belonging. So people need to feel a part of things and have connection. A sense of purpose, a sense of achievement and celebration of success. And then lastly, and most importantly, a sense of significance, that you matter purely because of who you are, not because of what you do, really. And Mike says in all his research, it's that last one that's the most important. It's the fact that people feel cherished and precious, really, just because of the intrinsic worth of human beings, really. And so basically what we like to do when we work with them, when we explore these senses in context. So and so we've got little questionnaires and discussion groups around these 6 senses. What do they mean for a social worker? What does this mean for an older person in a care? What does it mean for a family carer who's looking after somebody? So it's this senses, and this lovely cartoon sums it up beautifully. Sure glad the whole isn't at our end. So these could be senior managers in a local authority, and these are workers at the front line. But the boat is going to sink, isn't it, unless everyone's happy. So it's a good picture, because it's, unless you get everyone happy in a system, the system sinks. So, and the other thing is this thing about stories, and I like to always quote this quote by Terry Pratchett, because if we're focused on learning, whether it's just learning for, because we talk about evaluation for learning as well, because you can have performance-focused evaluation and learning-focused evaluation, and we prefer learning-focused evaluation. Stories are the best way that people make sense of the world. So this lovely quote by Terry Pratchett: people think that stories are shaped by people. In fact, it's the other way around. So if you want to shape someone's thinking, give them a story, because that just goes straight in. You know, it's like a Trojan horse, really, a story. We can't resist stories. We pull them in, and we get a hook in. They get a hook in us. And there's a lovely book called Storytelling Animals by Jonathan Gottschall, and I love this quote from him. He says, "We're a species addicted to story. Even when the body goes to sleep, the mind stays up all night telling itself stories." So if you want people to learn, we make sense of the world through narrative. So why are we using numbers and PowerPoint bullet points rather than stories to get people to engage with stuff? And it links with this old quote, which was attributed to Aristotle, which apparently isn't Aristotle: educating the mind without educating the heart is no education at all. So good learning has to have an intellectual response, so it makes sense to someone. It also has to have an emotional response. And when you get that two together, powerful learning takes place. And a lot of this training we do with people hasn't got an emotional content. It's all around policies and procedures, and it might have intellectual content, but it doesn't touch the heart, and then it fails to take root, really. So all good learning involves the emotions as well as the intellect. And the other thing is this dialogue I talked about earlier is, and what do we mean by dialogue? And it is more than just talking. So there's a research group at Cambridge who look at dialogue learning, and Rupert Hyam gave me this lovely quote. He says, dialogue, it's actually responding to others because they really matter, and building dispositions to seek out value and learn from the differences between us. So straight away, it's about encouraging disagreement and difference, and a multiplicity of viewpoints and voices. And sometimes that's frowned upon. I remember social workers I worked with once in one local authority, they said, we can never say what we really think, because they say, with management say we're being negative. So they just shut up. They don't say what they're thinking, and that's not dialogue. So, and what we found is in dialogue, it's you actually encourage disagreement, but in a way that's constructive rather than just getting annoyed with one another. And that's what some of our methods try to do. So we get different views, but how do we learn from the differences between us? And we use this elephant metaphor of reality all the time. So whatever we're presenting to people, whatever knowledge or situation we're looking at, it's a bit like this elephant. And the Indian fables around 6 blind people around an elephant. So you have the person holding the tusk says it's a spear, and the person holding the tail says, well, that's rubbish, it's not, it's a rope. And they start arguing, and then the person aside says, well, I don't know what you're on about, because it's a wall. And the person holding the leg says, no, it's not, it's a pole. And they end up fighting in this Indian fable. But of course, what it is, they've got to see all of their multiple perspectives, and they'll see the elephant in the room, the bigger picture. So we think this picture is really powerful. So whenever we do any of our deep work, we almost have a poster of this and say, this is us. And we're all going to see this thing differently. And that's good. And just because you're an unpaid carer who hasn't got any qualifications, it doesn't mean your viewpoint isn't important. You know, it isn't always the people with all the qualifications in the room that have got the insights, because we all see things through different eyes, really, in different angles. So the Cambridge guys told us about these 3 ways that people talk in groups. And they say it's really important that you understand the different ways people talk in groups. And the first is disputational talk. So that's like the House of Commons, where everyone's arguing with one another. This Brexit's marvellous. No, it isn't. Yes, it is. And everyone's got fixed views and nobody's learning. Cumulative talk is a way of talking where you talk and you're saying things and going, yeah, Jim, very interesting, very good. And then you walk out and say, what was Jim on about? I just have a load of rubbish. That was, I could have spent my time far more creatively doing something. It's where you don't say what you really think. And this is really common. And people don't say what they think in groups for all sorts of reasons. And there are 4 sort of common ones. One is often some people are introverts, so they might have something to say, but they don't say it because they don't get a look in because of all the extroverts in the room. There's the fact that a lot of us have got the imposter syndrome. So we think there are cleverer people in the room, so we don't say what we think because we think we might look silly. And then there's the that we might get it in the neck sort of approach, which we didn't say things because we might get told off. Why did you say that in front of the health board? You shouldn't have said that. And so there's worries of repercussions. Or there's the last one, which is a sort of a polite thing where we don't like to hurt people's feelings. So Martina's so lovely. I didn't want to disagree with her because I didn't want to upset her. And so you don't say what you really think because you don't want to hurt people's feelings. And these are really, they're meaningful, it's not helpful learning. So the guys in Cambridge say what you need is exploratory talk. And all of our methods use exploratory talk. And that's a way of talking where you say everyone, like around this elephant, has got a unique view and is precious and can say what they like. But they've got to give a reason. So I could say the moon's made out of cheese, but in exploratory talk, I can't say that. I've got to say, I think the moon's made out of cheese because I saw a film about a man and a dog, and they built a rocket and they took crackers up to the moon and they cut off cones of cheese and they ate it with the crackers, you see. And somebody else might say, well, they can't dismiss that and say, well, that's rubbish. That's just nonsense. You know, it's obviously the moon isn't made out of cheese. They've got to engage with it. So they might say, Nick, I agree because I saw that film and I saw a similar film and they were talking about Wensleydale cheese. And I think you'll find it's a particular type of cheese that makes the moon. But another person might say, well, actually, Nick, I disagree with you because I saw both those films and you'll find they're animated cartoon films. They're plasticine figures. They're Wallace and Gromit stories and by Nick Park, and they're not a documentary. So I use that as a silly example, but it shows you the nature of things. You're encouraged to agree or disagree with one another, but you must always say why. So you must never rubbish what somebody says. You always say, I disagree with you because, or Jim, I've got an example that illustrates what you're saying. Or Jim, can I share a story with you that says something opposite to what you're saying? So we invite each other to challenge one another nicely, really. And the other thing about exploratory talk, when you've got a group of people and everyone can't wait to get their oar in, so nobody's really listening and they're waiting for a gap and they go, and then they jump in. In exploratory talk, you can only connect with what the last person said. So when somebody's talking in exploratory talk, if somebody's talking, they say something and then they stop. Then if anybody wants to respond, they have to put their hand up and then they have to make a connection with what the last person said. So I agree with you because, I disagree with you because, and the last person speaking picks the next person to speak. So again, that stops one voice dominating a room, because when we use a joke, we say to people, if you talk too much, you'll only ever be picked once. So straight away, you get these ground rules for exploratory talk. So it sounds really simple, and it was developed in children's oracy skills, really. But we find they're just as useful for adults, really, because adults are often just as bad at talking with one another as a group of rowdy children, really. So, and I can send some links to that. There's websites in Cambridge University. So what I wanted to share was some of our, I'll stop sharing there, but that's the spirit. And then I've got these three methods and we could talk about either of them. Any thoughts on the DEEP approach? Because that's broadly the approach that we take. Any comments or thoughts or?
Nick, I find what was really impactful about DEEP and the presentation itself is that I think we don't often talk about the type of things that matters to people in terms of connection, belonging, tenderness. A lot of times, and yet when we talk amongst ourselves, like if I'm visiting the Cormarker project or I'm having a conversation with Laura, we're using that language all the time. If you sit down and talk to a worker, you're using that language. You're having these conversations, and so I think it's almost like that we have to learn a different language when it comes to evidence base and
we do, and you have to humanize it. Yeah. I'll send you a quote, and there's a report by Julia Unwin. Julia Unwin used to be the CEO of Joseph Rowntree Foundation, but she did some work with the Carnegie Trust UK, and she looked at kindness in public policy. And she's done this wonderful report. And she says our life's full of emotion and feelings, and somehow we've squeezed them out of public policy, really, because that's not the place. That's not the place for emotions. But she says our everyday lives are filled with emotions, really. So somehow we've got. She says it much more. I've got a lovely quote by her, but I'll send it you. And you can share in the report, because there's quite a bit of work around kindness. There's a guy called John Ballot and Penny Campling. They've written a book, Intelligent Kindness. It's around health service reform and social care reform, and it's around going away from performance and targets in public health service to relationships and kindness, really. And there's quite a growing evidence that by taking that relational, responsive way of working, rather than the perform or perish way of working, it's bringing out the better in people. There's a whole thing called human learning systems as well, which is great gathering momentum, which again is public service management should be around, it should be human-centered, learning focused, not performance focused, and about stewardship, tending the garden really, rather than micromanaging it to death. So there's quite a lot you can look up if you look up human learning systems. So DEEP allies with, it's not sort of unique, just DEEP we've developed in Wales, but it allies with like human learning systems in England.
Thanks.
I think just a quick comment and impression. I was struck by I think sometimes there's a critique of non-quantitative approaches or very structured qualitative approaches, that they're open-ended and loose. But I can see from DEEP there are rules. It's very structured. It's very ordered. Yeah, it's not a free for all. It's not loose. It's just a different approach, a different way of collecting data, you know, or engaging
with it.
And you have to learn it as well. So that's
so we run. So I can go through some of the methods now. I'll just fly. I've got community of inquiry, and I've got a particular example which I think is nice to illustrate that, how we looked at this concept of relationship-centered care, because it's really important what it means to different people, and how we used a community of inquiry and different sorts of evidence to change a professional boundaries policy in an organization. I mean, that's quite a nice example of, I thought I might use that to start with. And then we have a thing called magic tragic moments, which is around gathering stories of experience and then using those stories in learning and development. And then lastly is most significant change, which is focused on stories of change, not so much experience, but what's changed for people. So but if I start with the community of inquiry, because it's really simple, and it's, to me, it's one of my favorite methods to get co-production off the ground, really, because everyone talks about co-production. It's the thing we've got to do. But if you get off on a bad foot, it can go terribly wrong. And I remember I used to, when I was involved in planning in Powys in mid Wales, big rural county, and they said, the director says we need to talk to the service users, and we'll have a tea and cake, and they'll all come in, and we'll have a lovely time, and we'll all and they came in, and then one of the service users, for want of a better word, I don't like the word service user, but anyway, service user started to have a complaint about the authority, and then somebody got defensive, and then it got heated, and everyone's thinking, oh God, when's it going to end? When's this? It's just terrible. But community of inquiry is a really structured way of getting people with different opinions to explore together. So I just wanted to start with that one, if that's okay. Okay, and we run 3-hour training on each of the methods. So if you are interested and want to know a bit more detail, because I am just tipping, you're welcome to sign up to some of our sort of, because we've got, they're bespoke, they're standard workshops, so they're open to all, really. Is that okay? So I'll do community of inquiry first. So here's a community of inquiry. This is a group of older people, carers, practitioners, researchers, sat around in a circle. So the idea, we call it an antidote to meetings, because so many people have these meetings, and I work with the regional partnership board up in North Wales, and they said our meetings, if we're dead honest, are really dry, they're really boring. Can we do a more interesting meeting? So they use community of inquiry to look at young carers. They were looking at how to make the world better for young carers, and they used a community of inquiry methodology, which went well. But so you can use it online or in person. It's obviously much better in person. And basically, these are the steps. So I'll just run through the steps and then give you an example of how it works. So you always start with a stimulus for community of inquiry. So you get people around and you say, I'm not going to tell you what to do, what to think. What we're going to do, I'm going to share something with you that I think is important, and we want you to engage on your terms, and we want you to come up with your own questions. It's not like a focus group where you share something and you give people the questions you want them to answer. You say, I'm going to share something with you that I think is important, and we want you to come up with relevant questions that we want to explore before we decide we're going to do anything with the stuff. So it's about questions. It's about coming up with questions. And what you do is you share the stimulus with them. It can be a film, a story, it can be data, it can be anything really, but you want to make it interesting. That's the challenge. You've got to make it so it's engaging. And then you say, and it comes from what Cambridge guys said to us. They said learning is intimately linked with talking. So people have to talk to themselves. What grabbed you in that? What did you like? What didn't you like? What irritated you? What resonated with you? What annoyed you? It doesn't really matter, but have a think about it and jot it down on a post-it. So you get people to jot down on a post-it. And then you put people in pairs and you say, okay, turn to the person next to you and compare notes. And this is a lovely step, because what it does is, if somebody's not very confident about talking in a group, they're often happy to talk to a person next to them because it's only in pairs. So it builds people's confidence to contribute to a discussion. And also it opens up possibility that people have got different views. So Brian might say, well, I saw that, and Jim says, well, no, oh, that's interesting. I didn't notice that. What struck me about what was shared was that. So straight away you've got this idea of, you see different things, that elephant sort of scenario. And then once you've had 5 minutes of discussing in pairs, you put people into small groups and you say, okay, carry on the discussion of 4 or 5 people. And then what I want you to do is explore the themes that are relevant to our world, so they've got to be relevant. And then you've got to come up with a conceptual question. And we explain in more detail, I'm not going to do it now, but what is a conceptual question? But it's basically a philosophical or a conceptual question that has a concept in it that's worthy of discussion. It has these 4 features. So it's a question that will be common to everybody in the circle. It'll be a central question. It's a really important one. So, nothing trivial. It's a really important question. It's something that people can connect their experience to and relate to. And it's contestable. Different people will have different opinions. So you set this little test. You say, these are the 4 C's to guide your question, but you're going to design a question that you think it's worth us discussing for 20 minutes. So each little group identifies the question. Then people's brains are usually frazzled a bit by that, because they have to wrestle with things and come up with a question. You send them off with a cup of tea, and they go and have a cup of tea and everything. And then when they come back, we have questionnaering. And then each little group shares their question, and they say, this is our question. We think this is a question that's worth discussing. And this is how we came up with it. And this is why we think it's important. So we're already learning from people. They're saying, these are really important. So you start to understand each other. And each little group shares their question in turn. And then you have a voting system, and we say, okay, we can't talk about all of these questions. We'll vote on one question, and we'll put that in the middle of the circle, and that's what we'll discuss. And we use a very democratic way of voting. We say all the questions are brilliant, but we haven't got time to look at them all. We might another day, but today we're going to look at one of these questions, and you're going to vote which one you want's the most interesting. And they all vote on the question. And then we do exploratory talk. So we put the question in the middle of the room, or in the middle of the Zoom, whatever. And then we have exploratory talk about it. Does anybody want to start us on this question? So Brian says, well, I've got something to say about that question. And then once Brian's finished speaking, does anybody want to respond to Brian? They put the hand up, Brian picks the next person, and we're off and into this exploratory talk. And then when you've finished exploring the subject, then you go into a beginning of an action, not an action plan, but the seeds of action. Because you say, okay, I'm going to give everyone a last word opportunity now. So we've talked about this. What are the implications of what we've been saying? What do you think needs to happen? And you give each person in turn a chance. And you might have had somebody who's quite introvert and quiet, has not said a dicky bird in the conversation, but comes up with a wise word of wisdom in the last word session, you see, because it's often the introvert people who are more observant. And then when it comes around to them having their last word, they can say, but also we're really gentle, because we say, in your last word, you don't have to say anything. If you don't want to say anything, you don't have to. You can just say pass. So again, you don't have that horrible thing when you're in a circle and you think, I've got to come up with something clever to say, and I'm the last person to. Have you been in a circle like that? I have, and you think, oh no, they've just said what I was going to say, and that's it really. So that's a community of inquiry. So I'll stop sharing. The other steps, it's a lovely methodology, and it's safe. And what I find is, people who use it, it's good if you are a good facilitator. It works really well. But even if you're not a particularly good facilitator, if you follow the steps, it facilitates itself. So it's really nice because it's got these it's structured, and like Brian says, and it shapes the conversation, and it builds mutual understanding and kindness. So it is called community of inquiry because it builds relationships as much as it builds learning. So can I give you an example of where we used it, and then we'll have a chat about that?
Please do, Nick.
So one of the sites we were working with in the Joseph Rowntree project, it was around this research message which said all good support is grounded in and reflects meaningful and rewarding relationships. So relationships are really important, and there's lots of research that says that. So, and we all know it, don't we, instinctively, really. But what we wanted to do was, in co-production, you can't just start with that research and change things. You'll say, well, what's your evidence on that? So we basically gathered more research evidence on relationships. We gathered the evidence from older people and carers. We gathered evidence from care workers, and we gathered evidence from organisational policy, really. So this was a third sector housing with support provider who'd got a policy, a professional boundaries policy, really. So we looked at that policy because that was obviously there for a purpose, and it was a source of knowledge. So what I'd like to do is we called it evidence compared. We got a little sheet of A4 paper, and we put in 4 columns. Here's evidence from older people. Here's evidence from staff. Here's evidence from the organisational policy. And here's evidence from research. Have a look at that. Let's chew it over. So we use that as a stimulus for community of inquiry. So if I share it now, I'll share it with you if that's okay. You can have a look and just have a look at it for a few minutes and look at the columns and look at, and I'd like to be critical and say, where's evidence resonating and where is evidence looking like there's a bit of disagreement? So I'll just get Padlet, copy. So you should be able to cut and paste this. If you can't link on, you cut and paste, and you should go to a Padlet, and you should come up with a table. And I just like to spend, because I've talked a lot, just spend 3 or 4 minutes reading through the table and see what grabs you. Feel for it. Any comments on the sort of?
I'm conscious I'm probably the one doing a lot of talking, Nick, but I think what really struck me is I could see this in the context of a task force. In terms of a lot of times I think we all talk, it's almost like I can see the characters talking from from the things that matter to them, like the policy matters.
And it's come from a place, it's come from an evidence where abuse has gone on and stuff has happened in an organization. So
what I love about it is that it's that exploratory dialogue, that kind of, this is the reality on the ground, this is what we know works face to face, this is what the policy says, but this is what the evidence says. And I could imagine us at a task force having a discussion, engaging with staff, engaging with people with lived and living experience, engaging with the sectors that are around the table, and having really good discussion about that.
They had really rich discussion, because one of the key things was the older people said the staff are our friends, and of course the staff were told, oh, that's unprofessional, you can't be friends. So, and they had safeguarding training, you see, and they were told about, you know, if you put your arm around someone, you could be seen to be grooming them for abuse. So they were worried about doing that. And yet they knew, and they also felt they couldn't share the personal because that's burdening. They were told in some training that it was burdening the, but actually, so but they all needed exploring. So we looked at friends. We said, well, what do we mean by friends? And then we looked at, well, what do we mean by friends? And then we looked at all the facets and aspects of what makes a friend. And they ended up saying, well, actually, the staff are more than friends because I can share things with the staff that I don't share with my family because I don't want to burden them. And so we got really rich conversations. And people said, well, the professional boundaries policy is stupid. It's really restrictive. But then the HR manager who was in the meetings would say, well, I'll tell you a story. And they go, oh, God, I didn't know that. Did that really happen? Yeah, that happened. So, and everyone's starting to shift their thinking. And then, of course, the research is saying about reciprocity in care relationships, which again tends to go against all the professional codes of practice. The Julia McGarry, who's a nurse academic in Nottingham University, says that all the best community nurses are always breaking their codes of practice because they're doing right by people, really. And we call it undercover kindness. It's where people are doing the right thing, but they don't tell it because it's not quite in their job description. You know, it's so anyway, through those dialogic processes, they got this really sophisticated understanding of relationships because everyone says, yeah, of course, relationships are important, but there's it's complex, isn't it? And what they did, they changed the professional boundaries policy to a sharing lives and professional boundaries policy, and they had a little set of no-nos. There are things you definitely don't do. And those are black and white. But there's this whole area, grey area, where it all depends. It might be right with Mrs. Smith, but it's not right with Mrs. Jones. And it might be right with Mrs. Jones on a Tuesday, but it definitely isn't right on a Friday. You know, that nuanced decision making. And they devised a set of principles so staff could be creative in how they related and worked with people. But they always were guided by these principles so they could have a reason, they could justify why they were doing it. So they could say it's because I'm following principle number 1 or whatever. So it's and I can send you that, but so it's really simple, but it's that dialogic process. And community inquiry is one of the central methods we used because, you know, I think that one of the questions was can staff be friends with service users, something like that, and that created a rich conversation. We had nurse assessors who come in from the health board coming in who were totally against that, and then there were the staff who were sort of a bit ambivalent, and the older people. We had one older person who was originally from Venezuela, and she said, I married a Welshman and we came back to Wales and he died and I've got no family, no friends. And I asked the staff to be my friends and they said they can't be my friends. And she started crying. And of course, that has a big impact on the manager of the service who sat in the circle. And it's just really humanizing the whole.
We had a conversation yesterday, Nick. I'm just thinking about using this method. We're having a conference on harm reduction and living experience, and I'm looking at that community of inquiry, and I'm thinking about, wouldn't that be a really, really great thing to do, to be able to have that type of conversation around harm reduction practice and just the different perspectives from the policy and from
and you can have some stories,
really rich. Yeah, that would be really, really rich. I could really see that.
I do with social work students. I use one of the Greg Boyle talks because he does a lovely talk on mental illness, really, and he says a lot of so-called violence and gun violence and gang crime and everything. It's people are mentally ill. They're not bad people. They're just not well, and it's quite provocative. But he gets a great community inquiry going with social work students because they have to think outside the box, really, about.
How long does that take, Nick? Like
a community inquiry takes a couple of hours.
Oh, so it's a one-hour. Like you got that richness just from.
We did several community inquiry and did some other exercises as well. So, but community inquiry is one of the central methods we used. But we went out and gathered stories, and we did other things as well. They made digital stories and. So but community inquiry, I definitely recommend it. If you want to get a group of people to explore an issue, you can start with a story or two, or even 2 contrasting stories. We did one because in Bridgend, a lot of the unpaid parent carers of disabled children, they're really unhappy with the services that were provided. So we thought, well, let's have a community of inquiry. And again, it could be very conflictual. You know, you could have because parents are famous. They're always seen as these difficult people who are over demanding. You know, there's a sort of perception of parent carers of disabled children anyway. So we got them in a circle with the the council member, the cabinet member for social services from the local authority. We had the director of social services. We had practitioners, and we showed a film. And I've got a little film by a parent carer she's also a storyteller, and it's about her experiences of assessment. And she goes through the woods and she's pushing through brambles and everything. And we start with this story, but it ended up with this incredibly rich conversation, and the organisation ended up changing its direct payments policy as a result, which was, so it can lead, it can lead to significant changes. And
I think that's definitely something I'd love to explore.
I can send you the guide. We did some work in Scotland when we were doing the original, and Stuart Muirhead, who's in IRIS, which is the Institute for Research and Innovation in Social Services, he produced a little community of inquiry guide because he uses it. And I've got the little deep one, which goes into a bit more detail because we give the timings of, because how do you time it all? You do have to trip along. We tend to be quite strict on time, really, because if you can, it's one of those things, if you don't, again, stick to the rules, it can ramble and go off.
Yeah.
I'll send you all one from that. So we've got half an hour left. I didn't. I
just want to. I don't want to talk too much, or I won't be asked the next time. No, just a observation there. It's a really interesting technique because in the workplace, in educational environments, all kinds of places, people have to do lots of surveys. People collect qualitative data, and it's analysed. And I can imagine if that question had been explored, through a survey. Do you agree with this particular friendship? And it would have been I think quite shallow, but there within one column you've got a vast amount of exploration, and
there is data. There's full of packed with data. I want you to pay for, and it's rich, varied data, and so that's this knowledge democracy thing. I think is really important, and it's context then, because you take the research and then you say, well, let's pull it into the context of this third sector provider organisation. And I mean, it could be a drug and alcohol group because you'll have professional boundaries and you'll have relationships. They'll be really important because it's a sensitive, tricky area. And again, there aren't always hard and fast rules. So I thought, shall I just mention? Should we focus on most significant change, or do you want to do that one?
Yeah, thanks, Nick. That'd be great.
I'll just I'll slide through the slides because the other one we use is experience-based co-design, and that's a lovely one. And it's just it's really simple, and I'll just do one slide of that. And then I'll move on to most significant change, because that's probably the one that is most relevant. So, yeah, that's a little film, but I won't show it. It's a little film. So, magic moments, tragic moments. It comes from Health Service Improvement by a guy called Glenn Robert, I know, and Paul Bates. And they criticise health service improvement. Two things. They say, two things we seem to rely a lot on in health services, at least in the UK, is satisfaction surveys. And he says they're all right, but you can't do much with them. 70% of people are happy with the care. So what, there's not, you can't get your teeth into that. So, and he says the other thing is we love care pathways because he says they can look brilliant on paper, but he says they can be a disaster from an experience point of view. So he says just because something looks good, you go here and then you go there and the patient goes there and there. It doesn't mean that's a positive experience. And he says what we've got to capture are the highs and lows of their experience, the emotional touch points. And that's what we call magic, tragic moments. And basically this method is we just draw out of people what are their positive and negative experiences, nothing to do with change, just about experience, really. And they're always in little stories, really. So yeah, I'll pass through this because I haven't got time. There's a lovely story of the red line. Well, I'll tell you because it's only quick because I love a story. But this is a red line in a head and neck cancer clinic. And this was a negative emotional touch point. There was a tragic moment. Lots of people had tragic moments about this red line. So you could say it's a red line, in the reception desk, and there's a red line there. You could ask a group of people, what's going on then? Why is that a tragic moment? Why would that upset people? And of course, we could speculate until the cows come home about why. You could say it's red. If it was green, it would be better. Or perhaps it's crossing the Rubicon because once they cross the line, they feel like they're into a service. And we can have a guess, but the reality is only the people can tell you why it was a negative experience. And in this particular case, it was new patients who were going into the head and neck cancer clinic who were anxious, they were worried, and they didn't notice the red line and they walked straight past it. And the person at the reception desk said, "Oh, sorry, do you mind waiting behind the red line?" And they said, "Oh, sorry, I didn't see the red line. No, it's okay." And they were put off, and they went back and sat behind the red line, but it set them off on a bad foot for the appointment, really. And then people said, when you sat behind the red line, you could hear everything that was going on at the reception desk. And the researchers then went to the management in the hospital and said, "What's with the red line in the clinic?" They said, "Oh, we didn't know there was a red line." So the long and short of the story is they got rid of the red line. So it's a nice little story, but it's just, if you really tap into the experience of patients and practitioners, their negatives and the highs, you can use them to shape services. And we use emotion cards because some people find it hard to say about their experiences because they're often their feelings, aren't they? If you're talking about people's highs and lows, people are vulnerable. They're sort of sharing their experiences. So often we find they find it easier to talk to a picture. So pick a picture that says something about meal times in the hospital, and people will pick a picture, and then you talk about the picture, not the person. So that's that. I won't go into it in great detail. No, they're just often these little. I'll go past these, but they're lovely. But what we do with these, we do a thing called magic moments, and this has been really popular in health services and social care. It's always negative. Everything's moaning about what's there, and the media is always saying horrible things about social care, and not the positive things. And there's lots of lovely stuff that goes on in social care, and they're often little things that mean a lot to people, and they're called magic moments. And what we found with staff, they're full of these magic moments. They're not the things written in care plans. They're just little things. So this lovely little story, look, it's a home care worker in Porthmadog in Gwynedd. I was providing care to an older lady, and I noticed she had a lot of cross-stitch samplers on her wall. One day when I visited her, I noticed that my uniform was coming apart and asked if she wouldn't mind lending me a needle and thread to fix it. Her eyes lit up, and she said, and she said she'd be pleased to mend it for me. I handed her the uniform, and in no time it was as good as new. As soon as she'd finished it, she asked me if any of my colleagues had any mending jobs too. I now look out for anything she can mend for me and others. The care worker was shy to share this because she thought she'd get told off because it wasn't in the care plan. But it's a really magic moment. It's a bit of outcome-focused practice, isn't it? And so what we found is we gather these stories from staff, these stories and positive experiences, and we do that same dialogic thing. We read them out, we put them on the floor and say, which is the most magic moment? And different people go to different stories. And then we say, well, why do you think that's the most magic moment? Well, I think it's because that, and I think, and you're into that dialogue. And again, it's a lovely way of getting staff to engage with good care, but not through sitting them in front of a PowerPoint presentation. So that's magic. I could go in more, but I love magic tragic moments. It's really simple. We did it with a hospital, evaluating a mental health hospital, and there was an arts intervention. And we just put pictures on a table and said, pick some pictures that say about your experiences of the arts intervention. Patients and staff, they pick pictures, share their experiences, and we're off then and talking. And so that's that one. But I wanted to focus mainly on most significant change. Is that okay? Because this is the one that seems, I think, is really rich and profound, really. And then, yeah, so this is from the cover. It's the nice thing about most significant change. It's devised by Rick Davis and Jess Start, and they're not money-making people. Sometimes in the world of evaluation, you get people who want to make large amounts of money, don't you? Like Dave Snowden, who does the sense maker, and you have to buy this license to use his software. Well, with MSc, it's all homespun, and you can use it free of charge and adapt it. And I think that's a really important thing. But anyway, it's a storytelling approach to learning-focused evaluation. And the idea in MSc is that you gather stories of change from people. It starts with stories of change, and then you have a story selection process. So you can gather stories of change, and you can have a researcher sat in a cupboard, and they can go through the stories and thematically analyze them, and that's fine, and that's qualitative research. But in MSc, it's learning focused. So what it wants, you gather a selection of the stories, and then they get shared with a group of people of influence, senior managers, stakeholders, funders, and they have to really explore the stories in depth and learn from the stories. And then they have to come up with, so what they're going to do about it. They have to provide feedback. So it has this 3-stage cycle. You gather stories, you have a story selection process, and then you have to feedback what you've learned from the stories and what you're going to do about it. So it's sort of virtuous circle, really, an action learning circle. But where we've used it, it's been really effective. We used it to evaluate prevention work in West Wales. So in West Wales, all of the different organisations, from the National Park to the Health Board to primary care to the third sector to the local authorities, we're all trying to keep people out of services. But they're all doing it. They weren't sure what was working and what wasn't. And they all had different understandings of the word prevention. So how do we make sense of what we're doing here? Because it's a bit of a slippery fish. So they used MSc there, and it really built relationships in regional partnerships, really, because people got to understand what was really important. We've used it to evaluate training, because often training is evaluated in tick box way. What did you think of the presenter, and was the content useful, and all that? But this is what's changed. What good or bad changes have come about as a result of the training. So we had real narratives from people about what had changed for them as a result of training. We've used it to evaluate community development in Cardiff, which has shown the richness of community development, which again sometimes gets hidden in the usual metric measures. And the bit I want to share with you later, just before I finish, is we've used it in with Neath Port Talbot. They've been trying to improve the way they protect children and families, really, and work with families. And they've used it in evaluating peer support and also safeguarding interventions in domestic violence, really. So quite a difficult area and of work. It's been really powerful there. We've used it in evaluating community-based stroke and head injury rehab, which again, the normal measures didn't work, because the normal measures about like you couldn't walk, now you can walk 100 yards, you can walk 200 yards, and all these measures. But actually people were getting version 2 of themselves through community-based rehab. They were setting up lunch, breakfast clubs, and you can't measure that with a normal measure. It's only in people's stories that you get the change. And we've used it in a mental health recovery college, which again is a different way of doing mental health recovery, which is about community and about belonging and fellowship and all that stuff. And then we've used it to evaluate short breaks. So we've used it in all sorts of places. And it has these 5 themes that underpin it. So the first, and this is that guy I mentioned earlier, Ian McGilchrist, is it understands that the world is diverse, it's complex and dynamic, and there's a real danger of reducing everything to banal measures and statements. So, because you can't get a grasp of something, we'll have a proxy measure instead. But by the very measure sort of kills the thing that you're trying to measure, really. So, and Ian McGilchrist used the example of music. He says, if you want to evaluate music, you can't pull it to pieces like the components of a bicycle. You can't take the notes out and analyze them individually, or sort of say, is it the gaps? You've got to listen to the whole music, really. And it's that rich complexity. And of course, MSc is storytelling, and stories contain the whole. And it embraces complexity. So planning in complicated things is like planning a fancy meal, and you can have a logic model and you can do a step-by-step process. This is what we do, a theory of change. But he says a lot of human services aren't like that. They're more like a football match. So you can't really say 20 minutes in, player 4 is going to kick it to player 6, whatever. You've got to plan on the hoof, basically, and learn in a responsive way, really. So, and MSc is much more geared at people who are having a go at something and learning from what they've done, rather than planning everything to death and then never getting to do anything because they just have to do another plan. Does that make sense? And the second thing is, again, people make sense of the world out of story. So if we're going to have learning focused evaluation, it should be story focused. And stories contain the whole. So this is one way people measure in Wales. And most people who use this hate them. They're called outcome stars. And the idea is you take someone's life and you pull it to get to the components of a bicycle. So living skills, self-care, managing mental health. And where are you today, Brian? Are you a 3 today or a 4? And Brian says, oh, no, I'm a 4. And then you do something and then you come back 6 weeks later and where are you? And you end up with all these numbers, but we think they're quite meaningless sometimes. And it's a bit like the Bayer Tapestry, because in the Bayer Tapestry, there's a picture and a story and you can see what's going on. Harold with the arrow in his eye and this stuff. But if you pull all of the threads out of the Bayer Tapestry, you just end up with various shades of brown. And basically, we think that's what the power of story, because stories contain the whole. And if you want to see outcomes achieved in someone's life, you can't separate them out. They're sort of woven in this fabric of their life, really. And it's only in seeing the whole picture, the story, that you get an understanding of all of the different aspects of their outcomes. That makes sense. And the story I want to share with you later will show that, I think. The other one, and I won't show the little film, is people like to be included. So evaluation's often done to people and so imposed on them. And this guy, Kip Williams, he's a social psychologist in the States. He says, when you do things to people and leave them out, it really, for want of a better word, pisses them off, really, because they get either really angry or they get really despairing. And he talks, a lot of his research is around how you must do things in a participatory way, because if you don't, we're social animals, and if we're not involved, we'll get anxious or angry, really. And we all know that, don't we? If we're not in, we haven't got a foot in a stake in what's going on.
So when I was
and then the last thing, fourth thing is about this talking, because the panels, so we need to talk well, and the core function of these. I'm talking too much. I think I just feel I'm talking too much. I might stop. Yeah, I think I'm talking too much. I'm giving too many slides, and am I feeling that right? Am I giving too many slides?
Not from me anyway. I don't know.
No, I think it's incredibly interesting. I'm kind of just
well,
absorbing it as you're going there, Nick.
Yeah, but yeah. So you gather stories in MSc, and there are particular structures. So do you know the structure of MSc stories? I could just tell you that, because so basically, the idea, because sometimes people say, "Oh, we must listen to patient stories" or something, and you get these very, they're not sloppy, but they're very all over the place sort of narratives, and they're really powerful, but they're quite hard to get your head around sometimes. Sometimes they're very long. And when you've got people looking at them, well, what can we do with them? How can we? But MSc, you have very structured narratives. So you say to people, okay, you've been involved with the drug and alcohol project for the last 6 months. What good or bad changes have come about as a result of that? So you just put the ball in their court, and it could be changes in them as an individual. It can be physical changes, psychological, emotional, social, financial, and they just list their changes, really. It can be changes in other people, their children, their sisters, their brothers, their changes in their community.